from the Asian Community Development Council. This is Family in Focus, Mondays at 12 noon on PHLV Radio.
Hi, everyone. Welcome back to Family in Focus, our weekly show focused on the Asian American experience. And on this episode, we're talking about the pandemic's toll on healthcare workers, especially the very many Asian American healthcare workers here in the state of Nevada. And we do have some special guests joining me on the show today. We have Dr. Marife Axon Armstrong. She is the assistant professor at Roseman University of Health Science College of Nursing. She's also a host of Healthy Mondays right here on PHLV Radio. Also, we have Lisa De Leon Gamboa. She's the current president of the Philippine Nurses Association of Nevada. And finally, we have Sharina De Assis. She's the director of the Governor's Office for New Americans here in Nevada. Thank you so much, ladies, for joining me on the show today. What an important topic, especially with the pandemic that is still going on. We're now going on year 3. We're hearing some good news this past weekend that, the pandemic may be starting to kind of ease a little bit, but by no means is it over. And obviously the toll, both physical and mental, on healthcare workers in this country and also here in the state have been just massive. So I'm going to start actually talking with Lisa. And Lisa, again, is the president of the Philippine Nurses Association of Nevada. In your role, tell me about who you hear from, especially people in your association. They are nurses working, active nurses working here in the state right now, right?
Yes. We actually have a number of our members who currently are working in the front lines, from the acute care setting to home health, skilled nursing facilities. And we also have those that work in the offices or in the administration. So we have a variety of nurses. And so right now with the pandemic, whether they're working in the front lines or in the office settings, they are all affected. We are all affected by this COVID pandemic.
Yeah. And talk to me about the number, and we've talked about this before, the number of especially Filipino American Filipino nurses that are working here. And I think I just saw recent stats on how many of these nurses are coming in from overseas, not just the Philippines, but other countries as well. And you've been seeing that, right? Because of the need of healthcare workers because of this pandemic.
Definitely. So we have a huge number of immigrant nurses from various nationalities. When you go to a hospital, for example, you would see maybe half of the nurses there are Filipinos or Asian Americans, foreigners, because we do have that need for more manpower. And unfortunately, we're not producing as many nurses here locally. So we do have immigrants that supply that need.
Yeah, and I'm sure just in the past couple of years, now we're going to year 3, just the toll, obviously the toll of just being a healthcare worker is so great, but add on this pandemic. Tell me, how has it been for you? What have you been hearing? I know your own husband is still working on the front line in a hospital.
Yes. Just for example, last night, he was doing wounds, helped with the treatment on a patient that was positive for COVID. And he was so anxious. He didn't know if he needed to quarantine and sleep downstairs or come up. And he was like so stressed out. And he knew that this patient is going to be there for quite some time because of the extensive wounds. And he's saying like, oh, I can't be quarantined for a month, not seeing you and all that. So that's just one. But I hear a lot from our colleagues who are frontliners, that additional stress of contracting the disease and then giving it to their young ones or to their elderly parents, because most Filipino families, we have extended families living in one home. So it's quite difficult, and that stress is really just hurting them. Aside from the emotional, mental, they're also physically drained. We have heard that some hospitals have mandatory overtimes. So even if they're dead tired, working 12-hour shifts, they have to pick up extra loads because some of their colleagues have been afflicted with COVID. So
Mm-hmm.
now they have to make sure somebody takes care of these patients. And so those long hours, have cause physical strain and emotional and even psychological stress
Yeah.
among
It
peers.
and that's exactly the point that we've been seeing. It's not just, the physical toll, but the burnout factor that came with,
Yeah.
with this career right now. And I think this might be a good time to bring Dr. Marifé into the picture. I know you've been teaching at Roseman University for quite a few years now. And talk to me about the conversations that are going on, not just in the classroom, but outside as well when it comes to, going into this career, because you're the face of, talking to these students as they're getting excited to start, but also it's a really tough time to be going into this career as well, right?
Yes, and I wanted to resonate Lisa's information about burnout because the same thing is happening in academia. Some of
Mm.
our faculty are inflicted with the COVID, and someone has to teach the class, and someone has to bring the students to the clinical rotations. And the students themselves have to have this fear that if they contracted it, uh, they have to quarantine, and how are they going to continue school? So
Mm.
there's this fear of it's going to delay their schooling. So our university has been very creative in looking at ways how we can facilitate continuing their education without delaying their graduation.
Hmm.
Yeah, I think that everyone is affected with this.
Yeah, I mean, obviously, tell me about, working with these future healthcare workers, if not they're already in there, doing the clinicals and all that. What are they telling you? I mean, I'm sure it's been an interesting time. I'm sure they're learning a lot, but at the same time, they're told that it's, as you said, on the students themselves as well.
I think when the COVID started off, there's this fear of the unknown
Mm-hmm.
because we don't know very much about the virus itself, but we're getting to know it now. We're getting to know how it behaves
Mm-hmm.
and how it's potentially going to behave if it's mutate to another variant. And I think the students are more concerned about um, how are they going to survive the nursing school, or are we going to have the face-to-face experience taking care of patients, and when they eventually graduate and pass their boards, am I going to be prepared to be a professional nurse? And I think as a student, if they put their student hat, that is their concern right now. But if they put their family member or loved one hat, same fear that they have, am I going to bring this virus home? What if I get sick? Who's going to take care of my kids? Because some of the students are working students and also family, like their mothers
Mm-hmm.
and fathers. And so it's the same all around mental, physical, mental, and emotional fear that the students have. I do ask them, I also interview incoming student and I ask them, do you still wanted to go into nursing knowing that you might not be able to go into the facilities? We have this creative way of doing virtual simulation simulates how you would take care of a patient. How do
Mm-hmm.
you feel about that?
Yeah.
And some of them would say, well, I'll do what I have to do. Eventually this too shall pass. So we're seeing a lot of positive attitudes of incoming students, but as soon as they get into the program, they still worry about, am I going to graduate on time?
It's
Because
almost, yeah, it's almost, Dr. Marifé, that you kind of get to gauge who's really passionate and really want to do this field, but it's because of all the challenges and obstacles that they have to face now.
yes, and I know one of your question is how, what are you going to say to the new nurses and doctors? Um, I would say for them to be emotionally and mentally prepared,
Mm.
and they need to do some self-reflection. Ask themselves is if this is what you truly want to do for the rest of your lives.
Yeah.
But you also have to keep yourself equipped with the knowledge and skills and keep up to date the events globally. To be in healthcare field is to be, like you said, passionate and purposeful.
Mm-hmm.
Be a lifelong learner and always looking for ways to make things better. Um, One more thing, to be supportive of each other.
Mm-hmm.
Remind each other why you became a nurse, why you became a doctor, and find ways to always give back to the community and not just focus on your place of employment.
That's a great point. And I think, when Dr. Marifé, you're talking about that support, it has to come from so many sides, right? When you're talking about people in your work, your colleagues, from the association that represents you, or even from the state and federal government, the assistance that they may provide. And I think this is a good time to bring Sharina De Assis into this conversation. You're the director of the Governor's Office for New Americans. First of all, talk to me about what you do and what your office does, especially when it comes to helping minority communities, including Asian Americans.
Yeah, so the Governor's Office for New Americans, we're a fairly new office. We're established in the 2019 legislative session, and it's what was one of the priorities of Governor Steve Sisolak.
Mm-hmm.
He really leaned into the vision of a more welcoming Nevada, right? And that means welcoming over 20% of our immigrant and refugee population in the state. What my office does, we are a cabinet level office, so we do high level policy work, but we also connect our immigrant and refugees to all the services that are available in the state. So we really do promote that opportunity for immigrants and refugees to not only scale the economic ladder, but also civically and culturally, weave them into the fabric of the state, because we contribute so much, right, in our state, and it's time that our voices really and our issues are heard at the table of state government.
And when it comes to, the healthcare world, I'm sure this has been, the COVID conversation has been just in the governor's realm just for the past, over 2 years into 3 years now. What have you been doing in your office in terms of responding to especially Asian American families and workers who are out there and they say, we need help, and, we're not that group that's immune from this, and we're also very affected, especially healthcare workers?
Yeah, so what our office does is really we are a conduit. We connect people on resources. And we for healthcare workers, especially our immigrant and refugee workers, we try to uplift their contributions, because sometimes they do so much, they do so much for our community. They're risking their lives, and yet, no one talks about it. And that's why we really want to reiterate this contribution. Last month, we did a healthcare week with Governor Steve Sisolak, and we invited the Philippine Nurses Association of Nevada to have a roundtable to really uplift their voices, their issues, and their suggestions and recommendations on what the state can do to help frontline workers during this pandemic. It's been really tough, and we really want to support them any way we can.
And what Lisa was talking about earlier too, Sharina, about it's more than just the toll that they're facing at work, right? So you deal with Asian Americans, especially when, the cultural part of what we're dealing with, like you said, the multi-generational households that we usually live in. Talk to us about that and just kind of bringing those perspectives to the forefront, because that could really make a difference, right? Especially for workers who are out there just working all these long hours, and still they have to worry about just taking care of their patients, but also their families as well.
Yeah, so it's really tough. It's a compounded kind of thing, right? When you're an immigrant or a refugee, especially working in the pandemic, there's compounded by the rise of Asian hate. Because of the pandemic, and then you're also thinking about your family back home. I have family back home, and I'm not a healthcare worker. I worry about them, but can you imagine taking care of someone else's family, yet you can't take care of your family back home? It's really, it's a mental toll too. That's why we really try to partner with our healthcare organizations, right, like Tita Lisa's organization, to really bring them resources from the state level to address these issues, because it's sometimes you think it's unsustainable, right? But our healthcare workers, especially our immigrant and refugee healthcare frontline workers, have so much heart that they just keep on working, and it's really it's what the best you can do is try to support that.
And Lisa, let's bring you back in. I mean, when Sharina's talking about that, of Asian Americans feeling like, sometimes we have that kind of stereotype, and a lot of times it's true. We do give it 150% because we feel like that's part of our responsibility. What do you see out there, and especially people that you work with, and even your husband?
See, that's the one thing. We have this meek attitude or subservient attitude, you know, that is quite good when you say, okay, we do follow orders, we don't contradict, we don't question authority. But on the other hand, has a downside because we really don't tend to express how we feel. So if they say, okay, you need to work another day, you need to cover this shift or whatnot, we just say yes and just do our work. And a lot of the times, you know, um, for the majority, they're afraid to speak up because of possible retaliation or maybe discrimination. Okay, I did not say yes to cover one shift. Maybe the next time, if I request to be off, I wouldn't be able to get that request. So there's that mentality. And at the same time, you know, for the Asian nurses right now, and the immigrants, I would rather urge them to be able to speak up, you know, to speak their minds and just say, you know, it's all right to say no if you're tired, you know, because you do need that time to recuperate. And then the next time that you come back to work, then you're at your best shape. And that's the one thing that I really want to emphasize for this year is to make sure that nurses think of themselves as valuable and that they need to take care of themselves because they cannot give from empty cups. They need to practice self-care.
Yeah, and Dr. Marife, I know probably in the classroom, these are the things and information and that you give to your students as well to be your own advocate, right? It's not just about taking care of your patients, but you have to take care of yourselves as well.
Yeah, exactly. I just finished a class in nursing leadership and management. We teach them about how to communicate professionally, so you can actually say no without saying no. So if your plate is full, instead of saying no, let's see if I can find another person who would be probably perfect for this activity. So there's a lot of opportunities for nurse educators to teach nursing students how to be, how to do self-care at the same time, be professional about it. You know, as Lisa was talking about, if you're being given shifts back to back, you can say that, you know, there's ways to say no without saying the word no. And I think it's very important to educate our future nursing professionals how to exactly savvily do that.
Yeah.
And
I
it's
think
very
it's a conversation I think that has to come from from the management of these healthcare corporations. And Dr. Marife, you've been, you know, on kind of both sides working with people who run healthcare systems and also nurses. I mean, is there a conversation there? What are the challenges of making that kind of communication, especially coming from, you know, Asian American communities, like Lisa said, may not always feel like they are empowered to speak up when they should be?
Yeah, as an Asian registered nurse, I have a lot of stories. When I was an RN case manager, and then I was assigned in the emergency department. Immediately, someone told me, you have to have thick skin in this unit. And I said to myself, I don't have to change who I am. I just have to know how to communicate with the physicians. You know, they would challenge me when I say, oh, it would probably better to admit this patient with sepsis rather than pneumonia, because we can get the patient staying in the hospital longer, which means that sepsis it's a more serious condition. And sometimes they would question me like, who, like in a way that, who do you think you are? You know, are you a physician? Then I would say, let me show you the guidelines that I use, the Milliman guidelines, which was created by a physician himself. And let me show you what I see. And after that, when they got to know me, I really believe in actions speak louder than words. Say that you're an expert in this and you can do this, you're excellent in this, but show your action, show them that you are really excellent. And I think it's more powerful than saying that you are, and you show that you are, you know, a great worker. And a lot of Filipinos, Asians, we show them how best we work. We may have our strong accent, but when it comes to really knowing what we do, they see it.
Yeah.
So you receive that respect from other people when they see you in action.
I think that's very true, you know, in any fields, but especially when it comes to healthcare. And Sharina, talk to me about 2022. Now that we're going into this year, we know, you know, the governor has really stepped up in terms of, you know, in terms of testing sites and you know, supporting all the test kits that are going out there. What are we looking at, especially when it comes to helping healthcare workers moving forward? What more needs to be done from the state or even from the federal level? Oh, and turn on your sound for me when you get a chance. Oh, there we go.
I can't speak for the federal level, but for the state, we are really trying hard to mitigate this pandemic, right? Encouraging everyone to get the vaccine, get the booster shots, to protect our frontline workers as well. We've been in this pandemic for a long time now and everyone's exhausted. So that's what our messaging is. But it also is a workforce development question as well, right? How do we fill this healthcare worker shortage, right? How do we work with our communities, and how do we work with our skilled immigrants that are already here in the state that just don't know how to navigate licensing as well? And how do we help the new recruits that come here from all over the world to help with their shortage strategies? That's one thing that we're really working on for the Office for New Americans, is to help new Americans navigate, you know, the licensure and you know, culture-wise, how it is to kind of translate your experiences and skills here in the state to help with our shortage in healthcare workers.
I know we've been talking about, you know, getting these healthcare workers to be more empowered. Are there any programs, resources that you thinking that this could be something that, if they're listening and watching right now, could be something they could turn to, especially for the state level?
Yeah, so we do have this partnership with the National Alliance on Mental Health, or NAMI. They do have several programs. It's a nonprofit, and it connects to, you know, several programs like PRX Med or nurse groups that kind of talk about, you know, the challenges of working frontline workers, especially, you know, immigrants and refugees and during the pandemic. But we also have our Nevada 211, which is our state department's Health and Human Services service that connects Nevadans, not just healthcare workers, but all Nevadans, to state services that they really need. So that's one thing. But what we're intending to do in 2020 is to really do a targeted approach, right? And then Tita Lisa and I have talked about this, to really intentionally target our immigrants and refugees, especially our AAPI community that, as they said, sometimes doesn't seek help. It's a cultural thing or a stigma to seek help. So we're really leaning into more of a mentor kind of exploring mentorship programs with the Philippine Nurses Association and helping them kind of work with state agencies to kind of shore up those programs. It's still in the germination phases, but we've identified the issues and we're going to work throughout this year so that we'll address some of these issues, especially mental health in our frontline workers in this year.
And you brought up a really great point, and Lisa, maybe I'll bring you back in to talk about this, and we've talked about in the show before in terms of mental health resources that are out there. They're not enough, first of all, but also the fact that a lot of Asian Americans, especially, you know, there's that stigma attached to seeking help, right? Or they think, oh, I'm just tired and I don't really need mental health professionals when they do. Talk to me about that kind of dynamics, and what are you doing as an association to address that and maybe get people to see that if they need help, seek help?
Well, right now, the Philippine Nurses Association, I'm very proud to say that we are offering the Mind Body Strong course in collaboration with NAC. And it is a 7-week cognitive behavioral course whereby we have nurses attend every week and learn how to take care of oneself, starting with taking care of the mind and then taking care of the heart. And then that spells out into their actions and how they live their daily lives. Then we also have a mentorship program. It's a 10-week course that we offer to our members where we use Gene Watson's Caritas processes. So it's really very exciting that we are reaching our members who are Filipino nurses. However, we would like to extend that not just to our organization, but to the many nurses that are working in various healthcare settings, the hospitals, the skilled nursing facilities, any nurse that would like to avail of these courses. Of course, with that, we would be needing assistance from our state, and we're looking at grants and possible programs that we can tie those in so we can have an extended reach.
Definitely a time of collaboration, and it's great to have you, Lisa, working with Sharina as well, and getting that information out there. And I think this is what's key, is to let people know that help is out there, that you should feel empowered to seek the help. And Dr. Merfe, maybe we'll end with you, and just kind of looking and working with this new generation of nurses, especially Asian American nurses, going into this field, this kind of new face of healthcare. I think things are probably not going to be the same as they have been, right?
Yes, I think they had come a long way, and I think this is the best setting that they could ever have experienced. After this, we'll be sailing. After COVID-19 goes away, then it would be a normal. Hopefully,
Yeah.
it's gonna take a while before we get normalized. And I know that the thought of, as a nursing student, the thought of why some people does not want to be vaccinated, and having them educate the public, educate their own family about why the vaccines are beneficial. And I'm thinking about it that if we think about it, it's not any different from taking care of someone with end stage lung cancer or end stage kidney disease who continue to smoke cigarettes and or drink alcohol. And we always teach our student, be non-judgmental. You take care of each patient the same way that you would take care of your loved ones.
Yeah.
So, you know, the healthcare worker nurses are in particular, they are with the patients 24/7. They know the situation too well. And we continue on caring for them, teaching them how to care for themselves, and helping them to prepare for the inevitable. Maybe it's like a really serious case. And Lisa mentioned about it that, someone who would be dying from COVID, the family won't be able to see them because the process now is they will be cremated to avoid contaminations, right? Or it's contagious. So it does get tiring at times when you care for someone who's keep on doing what caused them to be in their situation right now. So the same way with COVID, we try to educate our students to be non-judgmental, but we're human beings, we have our own perspective about things. And to think that all that 12-hour shifts that you're taking care of this particular patient who is still not following instructions how to care for themselves, because they refuse to get vaccinated in the first place. And I can only speak for myself. Sometimes I really honestly wanted to say to them, I told you so. The mother in me scolding them. But we have to remain judgmental and avoid being prejudiced. And we need to take care of each of our patients the same way we take care of our own family. So that's the words of wisdom I would say to my students.
Yeah, and I'm sure Lisa and Sharina, what do you want to get out there? Kind of your last word too, especially when it comes to, like Dr. Marife said, healthcare workers who have to, treat their patients as they are, whatever choices they've made to get to this point in the pandemic. And Lisa, do you want to address, and then I'll have Sharina kind of end this conversation.
Yes, definitely. So, to all our colleagues and also the nursing students out there, we're living in these unprecedented times, right? And it kind of gets tiring. It's the third year.
Yeah.
It's exhausting. However, find that in your heart what you're passionate about. If this is really your calling to serve and to take care of the sick, of our community, of our patients, the main thing that you need to realize is that you're here for a purpose. and you are changing the world one life at a time. They may be resistant at first, but just continue on with what you're doing, educating them, taking care of their mind, body, and soul, because that's the holistic philosophy of nursing. You take care of the whole being. And don't lose hope, because there's help out there. We have peers, you have your family support. And, please don't be afraid to ask for help, because asking for help is not a sign of weakness. It's rather a sign of strength, because knowing that you need help, that's the first step.
And Sharina,
So we're
help,
here for you.
yeah, and Sharina, help is out there, right? And you just need to ask for it.
Yes, I'd like to reiterate that help is out there. And, I know there's a stigma in the Asian American community that it's weak to ask for help, or we shouldn't ask for help, but it is there. And the state is here to help you, to connect you to resources. My office, in particular, the Office for New Americans, is there to connect every single Nevada immigrant and refugee with any help and state services that you need. And I would also like to reiterate the importance and the contributions of our Asian American and Pacific Islander contributions in our healthcare system, right? 30% of our nurses are immigrants and refugees. 30% of our physicians are immigrants and refugees. 32% of our health aides are immigrants and refugees. And I always tell people this: if all API healthcare workers in Nevada disappear tomorrow, our healthcare system will be paralyzed. So I would really like to highlight the contributions of API frontline workers and all healthcare workers in the state of Nevada.
Definitely something to leave behind with this thought of if Asian Americans aren't here among other groups to help in the healthcare world, what would happen tomorrow? So thank you again, Sharina De Assis, with the Governor's Director of the Governor's Office of New Americans. Also, Lisa De Leon Gamboa, the President of the Philippine Nurses Association of Nevada, and also Dr. Marife Axon Armstrong with Roseman University. Thank you to all of you for joining us on this show today and talking about this very important conversation. Thank you, and
Thank you
for
Thanks
watching.
for having us.
Thank you, and we'll see you again on the next episode of Family in Focus.